Hi Microsport users, in this video we're going to go over the upper extremity setups. By that we mean the shoulder, elbow, and hands. The shoulder setups are one of the most asked support questions that we get. So it's important to understand that a lot of times the shoulder pain may come from the neck. The part of the neck, C5, that wears out first is also the nerve root that innervates the entire shoulder. So many of the setups we recommend include having that red at the neck. So red above, red towards the head will be here on this neck, ideally in that C5 area, which is right in the middle of the neck. So it's that point where we flex and extend, which is why it wears out. So red towards the head will be on that back of the neck. Blue will come over onto the shoulder. Now that can be on the front of the shoulder in a way that is right over the pain point. So if we turn and look here, so right on the front of the shoulder. This also, if you have pain, say over this, what we call a biceps tendon, can go right over that area. This is where it is nice to have sometimes that smaller electrode so that it kind of fits back in that area. This treatment here will bathe the entire shoulder. If you're having pain down into the arm, completely okay to go down onto the arm so that that treatment's going through the entire shoulder. A lot of folks will also move that a little bit onto the back of the neck and not so much on the back of the neck, on the shoulder as well, and that will work. Many times folks have pain in both of their shoulders, and the big question is, can I treat both of the shoulders at the same time? And the answer is sometimes. So a lot of times if you say have a rotator cuff tear or something very intense that needs a lot of healing, I would recommend that you treat just one shoulder. However, if it's just general pain or maybe you have a little bit of bursitis in both of your shoulders, this setup works up great. So you'll just put the red yellow on one shoulder and the blue green on the other. I tend to like the 2x4s, the larger size for this, because it tends to stay a little bit better. But if you can get the 2x2 to stick, that's great as well. So these again are great for things like bursitis. You can do it like maybe arthritis in the shoulder, and cartilage is often, cartilage meniscus is a great program to try in the shoulder, as that labrum is sometimes a big cause of different pain in the shoulder. The elbow is a great example of what we call a site-specific setup. By that we mean that you have pain in one specific site, usually a joint, and you're going to have that setup red above towards the head and blue below. So this is a setup that we would use, especially if she has pain on this outer side of the elbow, red towards the head, blue below. Keep in mind that the elbow though can sometimes have pain that is very much on one side or the other. So one side is called tennis elbow, the other side is called golfer's elbow. So she might have pain on the inside of there, and then what I would do is actually move both of those over onto that one side if her pain is all on the inside, or all on the outside if she has that other pain. If it's just a general pain throughout the area, what I would recommend is one on the outside and one on the inside. So the red on the outside, blue on the inside, or vice versa. This is going to bathe the entire area and really concentrate that current in there. Now, if you have elbow pain that is potentially from the neck, so you know you have a neck issue as well, then I would take this red and put it right back up on the neck, like our previous setup, so it goes through the entire arm. So that's the elbow. The hand and wrist is another site-specific type setup, meaning if the pain is here, we're going to just place the red up above towards the head and the blue below. So I like this setup because it really concentrates for wrist treatments. So you've got the current going from this less hairy forearm area down into the hand. It's easy to actually still do some work or things around there. This is great for wrist sprains, wrist injuries, fractures. If you are in a cast, keep in mind that they're going to give you your fingers open. So you're going to take this blue below and just stick it to wherever you can within that cast area. Many times it just leaves the tips exposed. It doesn't have to be completely covered. You don't have to have the pad entirely on that area. As long as it's connecting, it will conduct through the area. Likewise, this red towards the head is going to be just above where the cast is in that area. Keep in mind that if the issues are coming again from the neck, you will want to have this blue below down here, and then this red towards the head will be up on the neck as well. So this is a great setup. I love treating wrists with a microcurrent. It tends to be very effective. So programs that you would use for this would be fracture, night fracture. If you've had a fracture, you might use the sprains programs, ligament repair, carpal tunnel syndromes. If you have issues with things with nerve pain down into here, you're going to use that setup where the red is up towards the neck. If you're treating things on the fingers, this is a good question that we get all the time. You're really just going to place it wherever you possibly can. So if you have it right on that finger, you can just go red ahead towards the head above and then down onto that actual finger and even down onto, say, the thumb area. One of the most intriguing setups that garnishes a lot of questions are the water setups. So the hand is a great area to use water with because we have so many different facets of the surface. So if we're using a water setup, you only need enough water and a basin large enough to use it for that area to get the treatment. So this, even a little case like this, works great for one hand. So we're going to have Allison place her hand into the water. It just needs to be enough water to cover her hand. And then we're just going to place the bare tips of the wires into the water. So they do not need the alligator clips. They do not need the electrodes. They don't need any towels. You're just going to place them one on each side of the water. It's just so that they kind of maintain contact. So when they're in the water, you do not need to increase the current intensity. You can use the standard 100 that are on most of the programs. This is a great setup for work for, say, occupational therapists. You would get a larger basin. You could actually do both hands at the same time. You can do exercises while you're in the water. Great way for arthritis, to treat for arthritis. Great programs for this are any injury programs if you've had an injury. So your sprains, your night fracture, your night sprains, your post-op one if you've had surgery and you're not in a cast or in bandages, but also programs that are in that arthritis section. So arthritis, A1, arthritis pain, this is a great setup for that, but also those programs like joint stiffness, joint tendon release, as well as stiff muscle. All of those programs in that arthritis section are for loosening joints and reducing pain related to arthritic changes. And the hands are a great area that we can use those for.